Are you a side sleeper, or do you prefer sleeping on your back? Whether you're a side sleeper or not, you may have heard that sleeping on your side has some benefits. Now, this has raised the question of which side is best to sleep on. Is it better to sleep on your left or right side? Well, let's dive into the research and see what the science says about this. What happens when you sleep on your left side? According to research, sleeping on your left side may lead to an increase in pressure on your heart. In one study that explored the effects of body positioning on the electrical activity of the heart using an electrocardiogram, also known as ECG, it was found that there were more noticeable effects on the hearts of participants that were lying on their left side. In another study where an imaging technique called vectorcardiography was used to observe the effects of side sleeping on the heart, it was revealed that sleeping on the left side was linked with changes in electrical activity in healthy participants. The study also found that sleeping on the left side caused movements of the heart, such as churning and rotating. When participants slept on their right side, their ECG activity remained almost unchanged, and the study concluded that when lying on the right side, the mediastinum, which is a membranous layer of tissue between the lungs, helped to hold the heart in place. There have been reports of individuals who have congestive heart failure experiencing some discomfort and issues with breathing when they sleep on their left side. Now, take note that even though changes to your heart's electrical activity happens when you sleep on your left side, it doesn't mean that it increases your risk of developing a heart condition if you don't already have one, as there is currently no evidence to support this. What happens when you sleep on your right side? Although there's also currently no evidence showing that sleeping on your right side increases your risk of developing a heart condition, experts suggest that your vena cava, which is a vein that returns blood back to your heart, could get compressed when you sleep on your right side. When this vein gets affected in this way, it could lead to a compromise in blood flow to your heart and cause diseases. In one study on heart failure patients, it was found that they preferred to sleep on their right side when compared to their left side. Another thing worthy of note is that studies have found that for pregnant women, there is no difference in their health or that of their unborn babies when they sleep on their left or right side. However, doctors do recommend that they sleep on their left side. This is so because the liver is on the right side of the abdomen, and by lying on the left side, the pressure from the growing uterus is kept off the liver. Lying on the left side also keeps the weight of the growing fetus off the vein called the inferior vena cava, which is responsible for carrying blood back to the heart from the feet and legs, thus helping to improve blood flow to the fetus. Now, what side should you sleep if you have a heart condition? If you have a heart condition, ensure to speak with your healthcare provider about sleep positions to avoid. That said, one study that explored the effects of lying face upward on individuals with stable chronic heart failure revealed that there is a link between lying in a face upward position and poorer respiratory mechanics, blood movement, and blood oxygenation when compared to sitting. For individuals who suffer from sleep apnea, lying on the stomach may help for the symptoms and snoring, but take note that this position may cause back or neck pain. Also, be sure to get professional help if you suffer from sleep apnea, as it is associated with an increased risk of heart failure. Experts also suggest that if you have an implantable cardioverter defibrillator, also known as an ICD, it may be more comfortable for you to sleep on the opposite side of the implantation site. Now, although studies do not show any preference for which side is best to sleep on, we know that not getting enough sleep can have negative effects on your health and increase your risk of developing heart disease. Therefore, sleeping in a position that helps you get the most quality sleep is the best way to go. If you got value from this video, be sure to give it a thumbs up, subscribe to our channel, and hit the notification bell to stay updated with the latest health facts every single week.